my topic is really more geared towards, I think you could say, employer morality versus financial implications. And who better to address employer morality than the only elected official on this esteemed panel, a politician talking about morality. This ought to be good. We've got a situation here that if you're listening in all of the mainstream media or even the industry press, you would think that most employers are going to just drop their plans in 2 or 3 years when the exchanges come along and pay the penalties. And you know, when you say it fast enough, it sounds like the right solution. And then when you start to look at it, it begs you to think twice or maybe 3 times, because that's really kind of a false choice for the employers. And what I'm going to try to talk about, I'll divulge where I'm going with this way before I get to it, is that the choices that employers are at least being offered, or you think they're being offered, are to shoulder the additional costs of PAPICA compliance and all those mandates, or that being the first choice, or secondly, exit the healthcare system completely, drop your healthcare plans, pay the excise taxes, and let the employees go out and buy their insurance if they so choose to, and keeping in mind that they really don't have a choice to buy it because it's an individual mandate to go buy it by 2014. Those would be the choices you would sort of think that you have as an employer plan sponsor. However, if you look at the whole logic of this thing, if an employer is really, really thinking about doing that, they're suggesting that it's going to cost less to go out, pay the excise taxes, than to continue to provide the health care plan. And there's a lot of hidden costs on health care plan. We all know that. Some of you are in charge of administering your health plan. So you've got the cost of human labor in addition to the claims cost and all the insurance costs. But really, when you think about this as at least one of your choices, what I'm suggesting that's based on perhaps 2 false assumptions. And these are those false assumptions. Number 1, that the $2,000 excise tax is really the only cost that would be incurred as a result of exiting the healthcare system. And I guarantee you it's not the only cost. And secondly, that those 2 options which I outlined before, either paying the cost of the mandates for PAPICA or dropping the plans completely, that those are the only 2 options. I would suggest that there really is another option, and that's the one that I kind of want to explore right now. I'm going to kind of give you the ending of the story before I give you the whole action plan as to how we get there. And our eventual conclusion will be that most employers, not all, it does depend on size and does depend on a few other factors, will discover that eliminating coverage entirely will not be the optimum financial decision. And instead, perhaps and I know this is going to sound, not very nice, not very employee-friendly, but a significant reduction in the employer subsidy may be preferable to complete elimination. Now, none of those choices are very good, and it would be nice to be able to click along and just say we've been paying 70-30 or 80-20 and go that way, and I hope a lot of you can. But for those of you who cannot, maybe you're not working maybe the economy's not really where it needs to be, which we know it's not right now. Maybe your workforce is generally not very highly paid, and you can get away with that as an employer because that's the industry standard. But if you have to face some sort of a major change, what I'm suggesting is this might be an alternative that is financially more feasible for you as an employer plan sponsor. Before we can go into an exact scenario with the CC company that we've kind of built here, we have to understand the implications of the cost evaluation to get away from this penalty situation and instead just say we're just going to cut our employer subsidy. We need to understand that the penalty system under PAPICA is made up of 2 real options. The penalties don't have any formal names, strangely enough. So I've kind of nicknamed them sledgehammer and tack hammer, sledgehammer being the worst of the 2, although a smaller penalty, $2,000, versus the tack hammer, which is $3,000. But there's a real difference in the penalties. The sledgehammer, which is what's on the current slide, is really an availability-based penalty, while the tack hammer penalty is a coverage-based penalty. under the sledgehammer penalty, a $2,000, and here's the catch, per full-time employee is levied even if one full-time employee, just one full-time employee, does not have employer-provided coverage available. That's the first step. The second step, instead purchases coverage on an exchange, which we know we can't do until 2014, but we're kind of out ahead of this because you need to be thinking about it. And the third requirement, while receiving an income-based subsidy. Now you say, well, gee, who's going to receive an income-based subsidy? We talked about this back in April when it first came out that, gee, that income-based subsidy isn't going to be available to very many people. Well, yeah, it will be. A family of four would have to make over $88,000 in order to be ineligible for a subsidy. So the subsidy is going to be available to an awful lot of folks, which is why we have a $1 trillion+ price tag on this health care bill. The tack hammer penalty, on the other hand, while greater per individual, it's $3,000 per employee, but it's only levied on those employees who actually go out, purchase coverage on an exchange, and receive the income-based subsidy. So it's not on all full-time employees, it's those who go out and buy the coverage on the exchange with the subsidy. So those are the rules we're playing with when we're going to walk through this scenario. The goal here, if you're an employer, is to try to figure out a way to move away from the sledgehammer penalty and towards, if you have to have a penalty, towards the tack hammer penalty. That's the goal. So even if an employer raises the employee share of the premiums enough to cause the employee to opt out of the plan, the availability, and that's the key, the availability of employer-provided insurance coverage reduces the penalty away from the sledgehammer penalty and more towards the tack hammer penalty. Increasing the cost to employees for employer-provided health insurance will have some disadvantages. It's also going to have some advantages. But the most prominent and probable would be that employees will choose to be uninsured. Now, I say choose to be uninsured. We say, well, how can you do that? We have a mandate out there in 2014 that says you have to have insurance coverage. Well, you can choose to be uninsured and just pay the penalty, and the penalty in the early years is very, very slight that you would pay on your tax return. I mentioned last time that only 76% of Americans file tax returns. So 25% of them aren't going to probably get caught anyway, and the other ones will buy health insurance. And when will they buy it? They'll buy it when they get sick. So that might not be month 1. That might not be month 23. They might be 3 or 4 months into this scenario, 3 or 4 years into this scenario before they actually buy it. But along the way, such employees may seek insurance through a spouse. As an employer plan sponsor, would that be a bad thing for you? No. You probably, some of you I know, have already built in incentives into your plan to chase dependents away. Employee spouses, employee dependents. You've done it through cost measures. You've done it through measures in your enrollment procedures. If your spouse has coverage elsewhere, they may take that. They may have to take that. So chasing people to other plans isn't the worst thing in the world. What might be considered a moral disadvantage, as I mentioned in the last plan, people going uninsured, could also be a financial advantage. An advantage to the employer is that fewer employees will choose employer coverage, which means the employer's subsidy goes away. Many employers may choose to discount this strategy, and I think this is really where we're going to end up, by saying, if we take employer coverage away from the standpoint that we're not going to pay as much for it, what we're going to do in its place is give you pay. And it might be 100% displacement pay. It might be some percentage of that. But a lot of studies show that employees, depending on the industry, depending on their place in the social structure, value the option of dollars more than the mandate for insurance. And if you're in a situation where your employer is going to give you a raise in pay, and you have an option to go to an employer's or spouse's employer plan, you're kind of in Fat City. I got paid to move to another plan, and that other plan may be cheaper. So it's not all bad moral news from the standpoint of an employer's plan sponsor. So let's go into the specifics and see how it works in the CC company's actual fact scenario, and I had to add a few more facts that I didn't outline earlier because that was just too much fact pattern to begin with. So if we consider CC, which employs and covers all 300, we made that assumption all 300 of the employees are actually covered. They're all full-time employees. Now this is where we added some information. The annual average cost of insurance is $6,000 per employee. Now that's a blended rate. That's for single employees and family employees put together. We don't want to make this fact scenario drag out for an hour. And the employee pays $1,800 annual on a pre-tax basis, while the employer pays $4,200. If you do the math, that's a 70-30 split. And I ignored tiers, single family, employee plus one, employer plus children, that sort of thing. I just split it sort of down the middle, 70-30. Employer pays $4,200. Employee pays $1,800. All right? I wasn't even at the game and I'm losing my voice. The employer in the fact situation realizes after talking to their crack insurance consultants and their law firm, Fraser Stryker, that their costs are going to go up from $6,000 to $7,000 because of many of the items that we've already talked about or have yet to talk about. So we've estimated that there is an $1,000 annually per employee increase in the cost. This workforce in this particular case is not highly paid. The reason I throw that in there because when we get to the examples, I'll talk about the cost of vouchers and those who are going to the individual market, because perhaps they're under the federal poverty level of $88,000 for a family of four. That's why I put that in there. They're not highly paid, and the increase is unsustainable. CC is considering eliminating its insurance altogether. That's choice number one, on the theory that the employees can buy insurance on the exchange, keeping in mind that when you go to the exchange, it's a kind of a don't ask, don't tell. You know, there are no medical underwriting questions. Everybody can get it. And because everybody can get it, it'll be interesting to see how it's priced. And finally, as an alternative, CC is considering raising the employee premium. So this will allude to the two choices. Number one, scenario that we'll talk about is eliminating insurance plan completely. And number two will be raising the employee contribution. Scenario number one, drop the insurance. What are the cost impacts of that? Well, first of all, it eliminates the employer subsidy, and we said before that was $4,200. There's 300 employees. That's $1,260,000 of savings immediately. Have to think that's pretty good. Now, this particular scenario, what I happened to choose was we would increase the direct wages by the same amount that the cost of the employee was paying. They were paying $1,800. I'll give it to you in cash. That might be considered a little bit generous, but a lot will depend on the economy. If we're in a robust economy and you don't want to lose your employees, you're going to have to do that. You may even have to do more than that. But just for argument's sake, $1,800 is I'll replace your employee contribution with it. Times 300, that's $540,000 of cost. Now, we're going to incur the sledgehammer penalty because we did away with the plan. The sledgehammer penalty is $2,000. It's multiplied times the number of full-time employees. That's 300. That's a $600,000 penalty cost. The net effect in this situation of dropping the cost is $120,000 of savings to the employer, with many employees probably left uninsured. By their own choice, perhaps, but they're left uninsured. That would be scenario number one. You saved $120,000. Now, for scenario number two, I had to make some other choices on behalf of CC. I've done what I think are conservative choices. It could probably even be, a greater difference here. The first one, CC increases the average employee premium to $500 per month. Well, basically what we're saying is they're passing all the costs on to them. Now, that might be a drastic choice, but if you bear with me, there's some carrier implications. Some of you out there are thinking, well, gee, carriers say that you have to pay the certain percentage, 50% in some cases, 25% in others. I'll go a little technical on you. If the employees are paying for the plan through a 125 plan, that technically makes it employer contributions already. So technically that's 100%. You could probably get away with doing this. But bear with me as we walk through the other changes. The employee subsidy is now $1,000, so it's not fully paid. Remember, we went up from $6,000 to $7,000 because of the impacts of PAPICA. We're also going to suggest that they increase wages by $450,000, not $1,800 per employee, because we're not taking it completely away. We're still paying $1,000, so we'll give everybody $1,500 instead of $1,800. I think that's reasonable. So there's a $450,000 cost. We assume that the 70% of the employees will drop coverage when we tell them, hey, you're paying most of it yourself. That's an assumption. That leaves 90 people insured out of the 300. The 90 people that keep the plan are not the healthiest. I think this is reality. I always like to say, in a not very politically correct way, that you end up insuring the lame, the sick, and the ugly. So what you got is 30%, they're the sick ones, and that's what you've got on your plan. So because of that, what we thought was $6,000 moving to $7,000 probably moves to $8,000 because they're going to be more expensive to cover these folks that stayed on the plan. All right? So you've gone from now the employer subsidy of $1,000 to $2,000, but it applies only to 90 people. And these suggestions are kind of real life. These aren't just kind of made up numbers. So keep in mind, increasing the cost to the employees for employer-provided health insurance is going to have certain disadvantages, most prominent and probable being, like I said, that we're going to lose some of those people. I've got to turn my page here. So here's where we end up on scenario 2 of some other of the situations. We've got 210 people left. Remember, 90 kept, 30% of them. What's going to happen with those 210? I made some assumptions. 105 choose to be uninsured. In other words, half of those people are left. Half of 210 is 105. 45 add coverage through a spouse or parent. Keep in mind we could have some people working there that are 24 years old. Now with age dependence up to 26, they could join a parent's plan for free as far as their parents know. 30 end up on Medicare or Medicaid. Medicare perhaps because of illness, Medicaid because they qualify from either a disability standpoint or an income standpoint. And finally, 30 purchase our coverage on the subsidized coverage on an exchange. All right, those are just numbers we had to throw out to make this scenario plausible. Let's walk through the cost now. Keep in mind the first scenario you saved $120,000. So, cost of the new employer subsidy. It's $2,000. If you remember, increased cost of PAPICA was $1,000. Adverse selection caused another additional $1,000, so that's $2,000, but it's multiplied times the number of people who remained on the plan, 90. Now, I know you're thinking, gee, if you have a fully insured plan, and that was the scenario to begin with, a plan can go back and change the cost of that plan, which is really what we decided. They raised it another $1,000 because you had more than 10% of the people leave the plan. The carrier went back and repriced the plan. This is our new plan. So there's $180,000 of employer subsidy. Keep in mind the prior subsidy when we first started was $1,260,000. So we've already got $1,080,000 of savings. Now we're going to gobble some of that up. The increased cost of direct wages at $1,500 per head times 300, $450,000. You noticed that I was generous here. I gave the cost increase even to the people who stayed on the plan. So you could argue, you could take it away from them, but I didn't. I'm just generous that way. Tack hammer penalty, $3,000. We moved away from the sledgehammer to the tack hammer because we kept the plan available. So instead of the $2,000 times everybody, it's the $3,000 times the 30 people who purchased subsidized coverage on the exchange with the subsidy. So that's $90,000. We didn't talk today about free choice vouchers. We did back in April, but there are vouchers available at $2,000 per head, because that's the cost of employer coverage now. Times those same 30 people, there's another $60,000. So when you add it all up, the net effect is a $480,000 amount in savings by, instead of just dumping the plan and having $120,000, you quadruple those savings by still having a plan available and moving from the sledgehammer tax to the tax hammer tax, still paying for the free choice vouchers, still paying direct wages, but you've increased your savings. Now, that's the result, and you would say that CC in this particular case, CC being our client, is better off retaining the plan and just moving away from such a drastic employer subsidy. There are some not so subtle issues related to this sledgehammer tax, hammer tax. I mean, they may have been unintended effects. I don't want to go all political, but keep in mind, faced with this kind of a tax, what are large companies going to do? They're going to look at ways to move jobs away from U.S.-based territories. You don't have to pay this if you're based out of China or Mexico or wherever it might be. That's probably an unintended effect, but I think you need to think about that. And finally, if I have a choice to cut jobs in favor of automation, I'm going to do that. I don't have to offer health insurance to machines or technology. So unintended or not, those are downsides, of this particular law. Now, Brett is going to discuss two different topics, but minimum loss ratios and retiree subsidies that really are a real linchpin to PAPICA.